This is BoomerLife on CL 650.
I'm so tired, I haven't slept a wink.
Tell me about it.
I'm so
Yeah, we're talking about getting a good night's sleep. I'm Zach Spencer, and joining us today is Charnel Muir, the SnoreDentist. Did you come up with that, or did somebody give that to you?
You know, it's just always been something that we've joked about for years. So finally, I just put it on my car plate, and it became my website, and that was it.
Yeah, what is the website?
www.snoredentist.ca.
Now, the show is called BoomerLife. Now, boomers, typically of middle age and older, you're saying it's a much higher percentage of both men and women that snore at that age, right?
Yeah.
So when you're younger, it's quite low. And what would it be in the 50-plus crowd?
Probably 50% of the population or more.
So people listening to this show,
Yeah.
The SnoreDentist is here to help.
Yeah.
All right. So we talk about sleep apnea has become much more top of mind. People are hearing about it. I listen once in a while to certain channels, and they have ads for CPAP, mobile sleep apnea machines. So walk us through what sleep apnea is. We talked about the stopping of breathing throughout the night, but what it does to you and how harmful it is.
Yeah, we learn something every year new about it, but basically what we know is that it's going to, at a certain severity, limit your life. It will lead to higher mortality rates the more severe it is. It'll lead to high blood pressure. It's a significant relationship with the development of what's called type 2 diabetes, which is the kind of diabetes that we age into. It has everything to do with overall health.
Okay. With the not being able to breathe, does it, now I'm sure a lot of people would like to hear this, if it affects your weight, does some people put on weight because of this?
Yeah, it tends to be a bit of
because we've got to appeal to people's vanity, right?
I know. It's a little self-serving in that way. It's kind of like snoring is self-serving. So the more you snore, the more the tissues swell up, and the more you snore. With sleep apnea, it can be the same thing with weight. By putting on weight, you can make sleep apnea worse. Once sleep apnea is worse, it's easier to put on weight. So it tends to be a bit of a vicious cycle that way, because when you're not breathing at night, it really disrupts normal chemistry that's supposed to go on at night.
Okay, so you're not getting the rest and the rejuvenation and all of those things that help you get through the day.
Yeah.
And I remember a study that showed people who are tired tend to eat more.
Yes.
Through the day, which
Yes.
would that's the vicious cycle as well.
That's right. There's ghrelin and leptin and all sorts of hormones involved in eating. And it can also disrupt how you respond to sugar. So you'll tend to eat bad foods more, or you'll crave them because it'll disrupt how you react to them.
Okay, now we have heard about CPAP machines. Can you explain what they are and how they work?
So CPAP machines, that stands for continuous positive airway pressure. And it basically is a mask that's fit over your nose or nose and mouth, and it blows air down the airway so that it holds the airway open so you can breathe in and out. It doesn't breathe for you or supply you with oxygen. It basically is like the air that comes out of the back end of a vacuum cleaner. It's kind of like a gentle flow of air at different pressures, and it just keeps the tissues apart so they don't collapse and you can breathe.
It's kind of like the old BC Place Stadium that you had the roof was
raise.
held up with air, right?
Yeah, that's
and you had to keep that pressure constant
there
in order to keep it up, right?
Yeah.
So similar. All right, now that's a mask you wear at night, and a lot of people you look like somebody from another time or End of Days, what's that movie, Mad Max? That's what I'm thinking of. So people must not like wearing that when they're sleeping. I'm a side sleeper. I can't imagine it would be comfortable.
Yeah, and for some people, they can tolerate it. But one of the highest problems with CPAP therapy, one of the most common problems with CPAP therapy is tolerance. People just can't wear it, either they're claustrophobic or it restricts them moving at night, or they take it off in their sleep and they don't even know
realize
that.
it, yeah. Or the machine makes noise too.
And it does make noise. Now, the newer machines are much quieter than the older ones, yes, and they make travel versions, and there's all sorts of improvements that have been made to the therapy, but it still is difficult to tolerate for some patients. And studies have shown that of those that do start with the therapy, some won't even start, but some that do start, about 50% are still wearing it at 1 year.
Okay. I thought it was something you had to use forever.
Yes, you're supposed to.
Right.
But about 50% of patients at 1 year are not wearing it as prescribed.
They give it up.
That's right.
Okay, so that's where something like an oral appliance comes in.
Right.
So explain what the SnoreDentist does and what you fit in someone's mouth.
So the oral appliances that I do are custom made. They're two-piece appliances, and their main job is to hold the lower jaw slightly forward in a resting position, in a normal position your jaw can hold. And then it just prevents that airway from closing behind the tongue.
Is there a time during the day where your jaw would be in that position? Sort of driving with your mouth open? I don't mean, it's like is there something like just relaxed? Your jaw's relaxed? Is that how you describe it?
Most jaws will move forward and back about 10 millimeters front to back. And we start most patients about halfway. So if you put your lower jaw close to edge on your front teeth, or where you'd bite into a sandwich, that's about where we would start you with an appliance.
That's very little.
Yeah. It doesn't take a lot for most patients. Most patients are treated somewhere between 50 and 80% of how far their jaw moves forward and back.
Okay. Now, how do you fit this? I'm trying to picture it in my mind as to what it looks like and how it works.
Yeah, there's so many different kinds. There's about 80 different appliances right now that are available on the market by prescription. And there's some basic ones. There's ones that are called dorsal fin appliances, and they have this like jigsaw puzzle piece that when you close the jaws together, the bottom jaw slides slightly forward. There's ones that have bands on the side. There's ones, there's different designs that are fit specifically for what that patient needs.
Do you get patients that try one and it's not comfortable and not working for them and you move to a different one?
Yeah, we don't do that because all of them are custom made.
Right.
So we take impressions of that patient's teeth. We take the bite registration specific to them, and then that oral appliance is actually manufactured specifically for them.
So you're saying there's so many different avenues you can go down. That's your job as the expert to say, I believe this is the one that
this design will be better for you. Yeah.
Okay.
And we can treat patients even if they wear, for instance, some dentures. So more teeth you have, the more choices we have. So the more teeth, the merrier. But if patients only have 8 to 10 lower teeth and they wear a complete upper denture, I can still treat them. There's appliances that come in that design. Okay,
now, who is a good fit for this? Is this everybody that snores, or is it a specific subset?
No, everyone that snores is a good fit for this, as long as they have their adult permanent teeth. We tend not to treat children who are still in transition between their children teeth and their adult teeth. We'll tend to treat them once they've finished getting all of their permanent teeth in. But other than that, everyone who snores, the new guidelines and recommendations is that they should be sent for at least an evaluation as to whether an appliance would help them.
We're speaking with the SnoreDentist, Dr. Charnel Muir, and your website again?
www.snoredentist.ca.
Very easy to remember. And so when you come in to visit the SnoreDentist, walk me through how it works.
Most patients come in 3 different avenues. One is they'll be referred by their physician.
And is that a big education process, getting doctors to know you exist?
Yeah, just even teaching them that it's an available therapy. They can't prescribe a therapy they don't know their patients can find.
Yeah.
So they have to know it's readily available and perform to current guidelines and protocols. So 1, patients referred by a physician. 2, word of mouth. Patients hear about me. Patients find me Googling. Patients know that they have snoring or an issue. And the third will be CPAP companies. So if a patient discontinues or refuses CPAP, they should be looked at for an oral appliance for sure.
Can you use them together?
Yes, you can. And some of our patients use that. We call it co-therapy. So if a patient's severe sleep apnea is controlled with a CPAP, but at a really high pressure and the patient can't tolerate it, we can fit them for an oral appliance that treats them partially. And then they can reduce the pressure on their CPAP where it's tolerable. And that's really beneficial for some patients.
All right, let's talk about success rates. So someone comes in, they snore, they've got some level of sleep apnea. Are most people treated well with this?
Yeah, so it depends on severity and depends on what that patient also brings in for lifestyle and problems, for instance. So if a patient has excessive weight and they drink quite frequently in the evening, I'll have a different level of success compared to someone who is perhaps not as heavy in weight, but it is successful for the vast majority of patients. So milder patients have a higher rate of success statistically, but we treat severe patients all the way up to higher indexes. I've got one patient right now starting therapy who stops breathing 108 times an hour.
108 times. So that's less than a minute. I mean, that's crazy.
Yeah.
And one thing I want to get at is does the palate at the back that is obstructing the airway, can it relax farther? Like once you start at the, say you said your jaw moves 10 millimeters, you'll start at say 5. Once you start there and that seems to be working, do you have to adjust it as the years go by? Does your body adjust to that new open airway?
Well, snoring and sleep apnea progress with age. And it doesn't adapt to necessarily the position that you're in and therefore you worsen. It naturally worsens anyway. So sometimes your therapy will need adjustments, and we follow up with patients every year to make sure that they're still adequately treated.
You should be following up with the spouse every year.
Yeah, we want the
bring
real
your wife,
story.
Bring your husband.
Yeah. I wish more patients would come in with their spouse or bed partner. I really do, because sometimes I think they might be fibbing just a little bit. Just a little bit.
We never lie about our age either.
No. Or hair color.
The SnoreDentist is my guest today, Dr. Charnel Muir in North Vancouver. And I love the description of where your office is in North Vancouver. Tell us where you are.
I am kitty corner from the Oasis Car Wash. And if you know where North Van at all, you know where the Oasis Car Wash is.
When you said that, I was like, I know exactly on the corner where you are. All right, the SnoreDentist will be back after the break talking more about snoring and getting rid of it on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.